The Ross procedure is a complex procedure used to treat patients with aortic valve disease that are young and otherwise healthy. It's typically reserved for patients under the age of 60. In this procedure, we remove a patient's native pulmonic valve and translocate that into the position of the aortic valve. By removing that pulmonic valve and transferring it over to the left side of your heart where the aortic valve used to be, that valve can actually mature into a completely normal functioning aortic valve. It is the only procedure that is proven to restore life expectancy back to normal in patients with aortic valve disease. It provides the best hemodynamics of any aortic valve replacement or substitute. It is a living aortic valve substitute, so it has an added benefit of its own native protection against infection. And this procedure is really beneficial in patients that develop disease of their aortic valve at a very young age. So that's also a great option for those types of patients, or patients that do not want to have a mechanical valve and be on lifelong blood thinners that are otherwise active, healthy, take part in recreational sports or contact sports. This is really the gold standard treatment for these patients. There's not many surgeons across the country that perform this procedure. The surgeon has to be very intimately knowledgeable about the aortic root and aortic anatomy to fully minimize the risk in this complex procedure and derive the optimal outcome for this patient. Here at Valley, we take a holistic approach to aortic surgery. We have a humongous aortic aneurysm program here with over 2,000 patients that we follow. We're heavily invested in seeing the best care for them with a minimal amount of stress or impact to their lifestyle.